Learned this week that we're steps closer to a COVID vaccine, but who can get it and how will the state manage the demand? We'll get details from a member of the governor's vaccine advisory group.
Congresswoman Rosa DeLauro defeated an energetic challenger and heads back to Washington, where she is in the hunt to chair the all-powerful Appropriations Committee. She tells us what she sees ahead for the nation.
And Governor Lamont has an even larger number of Democrats joining him at the state capitol, with his party posting gains in the state House and Senate. Good news for him? Maybe not.
It's all ahead, Sunday, November 15th, 2020.
From Eyewitness News, this is Face the State, Connecticut's most watched local political program.
Good morning. I'm Kevin Rennie.
And I'm DUBY McDowell. Earlier this week came the welcome news that Pfizer is 90% of the way towards a COVID vaccine. Are you eligible? And where will you go to get the vaccine? It's a gargantuan undertaking.
Here to discuss the logistics, Dr. Jessica Abrantes-Figueiredo, Director of Infectious Disease at St. Francis Hospital in Hartford, which is part of Trinity Health of New England. She's also a member of the Governor's Vaccine Task Force. Good morning, Doctor. When do you think the first person will be injected with the vaccine in Connecticut?
Good morning, and thank you for having me. So that's a great question that everybody is kind of looking forward to. And while I don't have a specific date, we have an inkling that likely, potentially by the end of the year, if not first quarter of 2021, we will likely have a vaccine available for folks to receive.
Oh, you said as early as the end of this year, we could possibly have some vaccine here.
Potentially, and it's mainly just because of the, now use of emergency use authorization. So some of the companies will likely look into that, which will take time. And then shortly thereafter, if it does get approval, then we would have that vaccine available.
How is it decided how much of the vaccine comes to Connecticut? And are you confident there will be enough?
So a lot of that will be multifactorial. So it'll somewhat depend on federal and then, CDC and then at a state level as well of who's or how many doses will be available to Connecticut. Based on Governor Lamont will likely be estimated to receive about 1% of each of the allocations. So now there's multiple vaccines being studied currently. Will we have enough vaccines? Likely in the beginning, that is a definite no. There's going to be limited supply. So that's where we'll then look at kind of allocation and who should get the vaccine first.
We understand from what we learned this week that this is a 2-dose vaccine. When does it become effective in fighting the virus?
Great question. So I think some of that is based on preliminary data and still ongoing, and still even once vaccines get approved will still need to be studied. And as far as the Pfizer vaccine, it was about 1 week after the second dose that they saw some effectiveness with regards to preventing infections in those that received vaccine versus those that received placebo.
And how much time is there between the first and second dose?
So with regards to Pfizer, it'll be 21 days. Some of the other vaccines may be a little bit longer, 28 days. There are some in the pipeline that may only need 1 dose. So all of that will be dependent on the specific company.
Can you talk again, this has been out in the news, but the priorities, who are the priority receivers of the vaccine?
Absolutely. So multiple entities are looking at who will be the priority. We are looking at, healthcare workers. So those who are most at risk of becoming infected, and not only who's at risk of becoming infected, but who will then be at risk of getting severe disease. So patients or community members with high risk comorbidities or other, healthcare problems that can cause severe disease. So cardiovascular disease, diabetes, those who are older as well. So those are the folks that will likely be allocated to receiving the dose first.
Doctor, why does the vaccine have to be kept so cold? I keep hearing references to the cold chain in the manner that it will be distributed.
Yeah, so each of the vaccines, specifically with Pfizer, it's a newer available vaccine of the messenger RNA. And really it has to do with the stability of the vaccine, and keeping it cold at extremely cold temperatures actually is what's necessary to make sure that it stays viable. So Pfizer will be looking at somewhere between -70 to -80 degrees Celsius, which, like you mentioned, is extremely cold and something that hospitals and St. Francis and Trinity Health of New England are looking into to make sure that we are ready to be able to store the vaccine for our patients or healthcare workers.
Does this need to have the the vaccine be kept in this cold space? Does that mean it's going to be more complicated for us to have drive-through vaccine areas the way we have drive-through testing currently?
Great question. It, I think, will complicate things a little bit, and just like how we've dealt with this unprecedented time and had to become innovative and creative, we will still likely have to look into how we can efficiently, effectively, and quickly distribute the vaccine. So those are ideas that we still are looking into to make sure that we can have this available for our communities.
Doctor, when we do have the vaccine and this becomes closer to a reality, how do we convince vaccine skeptics to get vaccinated?
So that's something that we want to, as physician leaders, as scientists, to really convey to the communities, and especially folks who are skeptics. You know, there's a lot of concern with regards to how fast things are going. The nice thing, or the great thing, is that most of these companies have been extremely transparent, and I think that's going to be key, the transparency of the data and making that available to the public as well. The trustworthiness, the truthfulness, to make sure that we have all of the data out there so that we know that it is effective and that it does work and that it would be safe for our community members as well.
Are there other vaccines that you've seen being developed that are close behind Pfizer and making an announcement?
Yeah, so there's definitely other vaccines that are, closely behind. Moderna is another messenger RNA vaccine, that's likely closely behind as well. And there's other types of vaccines that are out there that will likely soon also have more data available so that we can, refer to those and look through and, understand the science behind that as well.
So I imagine that just the way we are always have our driver's licenses with us, we're probably at some point all going to be walking around with a card that shows we've been vaccinated.
Potentially, that's a great point. And I think you bring up a good point, actually, so that community members understand there likely won't just be one vaccine available. And when, like we've talked about, many will require 2 doses, sometimes at different time frames as well. So it'll be very important for patients or yourself to know which vaccine you've received. And then as well as physicians and providers to understand which vaccines folks have received, because you will have to receive the same vaccine type.
Well, thank you so much, Doctor. We really, really appreciate the information.
Thank you for having me.
Democrats in Connecticut's races for the state House and Senate won additional seats. A plus for Connecticut's Democratic governor? Not so much. We'll discuss.
But first, Congresswoman Rosa DeLauro on how the presidential transition is unfolding. Is she concerned?